It's time to talk about the flu again and why a flu shot is so important. Joining us to talk about the proactive steps we can all take to stay healthy this flu season is Dr. Joy Hong, a pediatrician with ProHealth Physicians located in Glastonbury. Dr. Hong, thanks for joining us.
Yeah, thank you so much for having me. I'm excited to talk about keeping people healthy this fall.
So, Doctor, tell us a little bit about yourself first. How long have you been practicing, and what's your favorite part of your day?
Oh, thanks. So I'm a primary care pediatrician. I practice in Glastonbury, Connecticut as part of ProHealth Physicians. I've been in practice for over 20 years now. Love taking care of kids. And I would say probably the best part of my day is when a parent comes in and says, you know what, last year at the checkup, you told my kid to do X, usually eat more vegetables, drink more milk, play outside. And you know what, they listen. So just that chance to really impact a family and a child's health in a positive way is really what makes my day.
Well, that sounds super rewarding. Thanks for sharing that. So I'm reading based on what's happening on the other side of the globe in countries that are already in their flu season, that way we may be in for a rough season. Are these predictions reliable? Should we be worried?
Yeah, I think that's a good question. I don't think worry is the right word. I think thinking proactively about ways to stay healthy is the way we should approach this. We have seen, with masks off after the COVID pandemic, that really there is a lot of outside of the normal range flu season activity. And I think that's something we're going to continue to see as we head into this next 6 months, year, that we just need to be vigilant about using protective measures to prevent ourselves from getting the flu.
All right, then. What are some key ways to keep from getting the flu?
Okay, excellent. Thank you for asking. I think actually first and foremost, get your flu shot. The flu shot has been around and has been in use for many, many years. It's a little bit different every year because it gets tweaked based on the prevalent flu strains, but it has been shown to protect us from hospitalization and severe illness.
So let me ask, are the preventative tips, are they different for kids versus adults, or are they pretty much interchangeable?
Yeah, good question. So flu shots are available for anyone 6 months and up. So really that preventative tip applies to everybody. The other things that are really helpful for preventing flu are good basic hygiene. So take care of yourself. Wash your hands before you eat. Wash your hands when you've been out and about shopping or doing other errands. Cover your cough. Use tissues if you're going to sneeze, those kinds of things. But really hand washing and attention to self-care, like good sleep and good quality nutrition, are some of the best things we can do to protect ourselves from the flu.
Okay, and who should take extra steps to protect themselves? Who would be at high risk for flu complications?
Yeah, again, really good question. So people who are in certain categories, people who have chronic illnesses that result in immunosuppression, people who have underlying immune disorders or on chemotherapy for cancer. And certainly those at older age risks, like over 65, generally are more at risk from severe illness with the flu. Younger children as well, between 6 months and 2 years of age, are slightly more at risk of complications like hospitalization from the flu. And so really for those age groups, we really do especially encourage flu vaccination. I know a lot of parents come in and talk to me about, my baby is healthy. Why do I need a flu shot? I don't think a lot of people realize that those younger age groups are a little bit more at risk of complications from the flu, just like the older age groups. So really, if you're in that high risk category, please take the extra step of protecting yourself with a flu shot this year.
Okay, and then if you do get the flu, how can you tell if it's flu or if it's COVID? I mean, and the symptoms overlap?
That's a really good question. And to be perfectly honest, we test. The best clinician is not going to be able to tell you without a test whether or not it's flu or COVID. A lot of the symptoms overlap. There are a lot of body aches, fevers, headaches, fatigue with both of these illnesses. COVID seems to be a little bit more likely to cause loss of taste and smell, but all of the COVID strains don't do this, so that's not really reliable. So honestly, I recommend if you are concerned and you have a fever-like illness with cough, cold, runny nose symptoms, it's reasonable to get yourself tested for both the flu and COVID at this time of year.
Okay, so let me ask, if you've had your COVID shot, if you've had all your boosters, is it still necessary to get the flu shot?
Love that question. Yes, they unfortunately don't overlap in their protection. So you really do need to get both vaccines to fully protect yourself from illness. The COVID vaccine is great at preventing severe illness and hospitalization and death from COVID, which I'm so thankful for. It's been a game changer in this pandemic. The flu shot is great at preventing serious hospitalization, illness, and death from flu. They don't overlap at this point. Maybe in the future we're going to have a combo shot, but we don't quite yet. So for now, yes, it means 2 shots this fall.
Well, so what that sounds like to me is that you could unfortunately have both COVID and the flu.
Yes, you can. Unfortunately, you actually can. And I have had cases where patients have had both at the same time, and it's not fun. So, really, I think this is one of those times where do what you can to protect yourself from what you can protect yourself from. We have resources available, and please use them.
Sounds good. Where should viewers go if they have more questions about the flu or COVID or, either?
Yeah, I think that's a great question. There's some really good resources. The cdc.gov website is phenomenal. They have really good up-to-date information about how to access all of these. In Connecticut, Department of Public Health website actually has some great resources. And of course, my all-time favorite, prohealthmd.com has all of the resources to our local care facilities. We also have the availability for you to book online flu shots. If you're a ProHealth patient, you can actually go right to the app, book yourself into one of the flu clinics, and show up at the time you're scheduled. It's super easy. So I think those are some really good resources for people to know about.
All right. Sounds good. We've been speaking with Dr. Joy Hong, a pediatrician with ProHealth Physicians. You can reach Dr. Hong at the Glastonbury Pediatrics and Adolescent Medicine in Glastonbury, or to find a doctor or healthcare professional in your area, go to prohealthmd.com. And Dr. Hong, thanks for joining us.
Yeah, thank you so much for having me, and stay well.